COO at the Center for Family Health, Bill Wypyski, and I knew it. Is that right?
I should have done this.
Wypyski, Bill Wypyski, the current COO and previously interim CEO, Sara Benedetto. Welcome to the show.
Well, thank you.
Good morning.
Thank you. Good
Good morning, guys.
Since yesterday, we've been practicing
We've been
your name.
practicing.
Yeah. It's been a long life.
Me too.
So tell us a little bit about how you got here to Jackson. This new great position.
Absolutely. Actually, it's been a journey, to say the least, but a very worthy journey. Back in September, the recruiter for Center for Family Health reached out and found me on LinkedIn, and the process started.
Yeah.
And I had a chance to interview, I think a total of 3 times with the board, and the board had some truly great questions. Some were a little tough, but that's okay. That's okay. They wanted to really vet the CEO candidates. So, and then at one point, a few months ago, I was given the tap, and I came. And I'm very, very happy being here.
That's awesome.
Yeah.
And I know Sarah's happy.
I'm very happy. We all are. Yeah, we're really excited. It's been a fun few days.
Yeah.
I know it was a grueling process, a search process. I actually had a couple people call me.
For the job?
No, they wanted. They had their applications in, and they wanted me to give a good word about them. And they were highly qualified, excellent people, and so I knew you were getting the cream of the crop in terms of candidates. So congratulations.
Yeah. No, I want to give a shout out to the board. The board did an excellent job vetting and having a good process in place, and I think that benefits the organization for sure, the community health center, and it also benefits the community. So win-win.
Bill, will you be new to Jackson then?
Yes, absolutely. Be new to Jackson. I'm actually coming from Iowa, the western side of Iowa, small town. Sara and I were kidding about who's ever heard of Council Bluffs, Iowa, but it's right next to Omaha. So
In your background, you've been with what are known as federally qualified community health centers.
Yes.
Which Center for Family Health is.
Right.
So what are some of the things in your background that are going to translate for the benefit of the Center for Family Health?
Right. I believe that the board looked at the fact that my early career, I've been doing this for quite some time, 35, 40 years. I started out actually in behavioral health. I was a therapist for a bunch of years. And then I got into public administration and turned into an administrator. Worked at a psychiatric hospital for 17 years. And then from there began to do community health. And the healthcare model of community health centers is beautiful. We have an integrated staff of medical, dental, behavioral health, mental health, and social services. That all works together to produce a whole person approach to care. And I couldn't imagine being in a different kind of healthcare environment.
How about the facilities at the center?
Yeah.
I mean, just amazing. What was your impression when you first kind of became aware of the position?
Right. No, I've worked at and been around the country, and I would say that the welcoming environment of the buildings that Sara has been part of, Molly as the former CEO, you walk in and I felt that in my first interview. I was like, wow, this is a place I'd like to come to, not only work at. And it's everything. It's the doors, the colors, the welcoming staff. You really feel that we're glad that you're here.
Yeah, I think as a community we're very proud of what we have, and we kind of feel like there's nothing else like it.
No, comparatively, no, there isn't actually, and I think the community should be proud. Michigan should be proud of it, and I can only hope, and I plan to really just build on the great reputation that's already there.
Sara, what was it that the board liked when they found Bill?
Oh gosh, I think his experience that he's had, and having particular experience with the community health center is very important, especially given a transition that we've had. So I think that was one of the things, and actually looking for someone who was very mission focused and really connected to building on what we're already doing. And so I think that is something that certainly I've seen in Bill in the last few days. And we've been working together via Zoom and phone calls for a couple months now. So so it's
I like the fact that you have a strong background in mental health services because that's been a big focus of our Center for Family Health.
Yes, it is. And I think there's a lot of still opportunities there, so we're really excited to pick Bill's brain and see what he's been doing at his place. And we've also shared a lot there already too. It's like, what do you guys do? And what do you over the last couple of months. So it's been great.
You've really got to approach people as truly whole people. There may be high blood pressure or diabetes, and you want to find out what else is going on contextually, and what makes them tick as a person. They are not their disease. They are a person first and foremost, and secondly, they have issues that we want to help with.
And so many services available for all. Yeah,
absolutely.
It's amazing.
Yeah.
Are you going to miss the food on the stick at the Iowa State Fair?
You know about that.
We definitely know about the Iowa State Fair.
When I first went out to Iowa, I knew two things. I knew the Mutual of Omaha, right? Because I grew up as a kid watching the animal shows, and I knew about the Iowa State Fair, and more specifically, the butter cow. Literally, everything else, I don't know. I miss it a little bit. But I hear we have a fair here in Jackson.
We do.
Yes, we do.
I was told about that.
We do.
Just yesterday.
Right across the street from Center for Family
That's
Health,
right? Yeah, walking distance, for sure.
Yes.
Yeah, in fact, you probably don't know this, but you're going to be out with a money apron collecting parking.
We actually talked about that yesterday. We're like, okay, we got to gear up.
The community.
Yeah,
it's that time.
I'm good with it. I'm good with it. No, I love fairs, and I just can't wait. And one of the first things I did while I was interviewing is I stopped at the local commerce here, Chamber of Commerce, and they gave me a whole slew of stuff, and I was like, wow, this is like a really great place to go to. And I mean that, I really do. I'm kind of an outdoors guy, so I'm looking forward to get into the lakes. I kayak, I bicycle. Sarah and I were talking about hiking.
There's lots to do. Pickleball,
We've got
tennis.
Yes.
We have all those, all that good golf
We
courses.
can get you set up with a list of all those activities before you even leave.
Yeah.
We can get you signed up.
Sarah actually lives on the trail, so you can
I
park.
do. I live very close to the trail. Yeah.
Wow.
You can park at my house and.
Just go.
Yeah.
One thing that's been really good too, in talking to Sara and getting to know her, and one of my big things is the transition. I knew Molly was in place as the CEO for over 30 years.
Founding CEO.
Founding CEO. So something I'm being really mindful about is how do I listen for at least the first month or two? How do I really understand the culture and build on that, not just wipe it away? So I'm really hopeful. And Sara and I, we click, I think. And I'm looking forward to our partnership.
Yeah.
And you've been really, I'm going to say out loud, you've been really gracious about letting me in and transitioning back to your full-time COO. I appreciate that.
Well, thank you, Bill.
I do.
Yeah.
Yeah.
Molly's Sarah's very clickable.
Very good.
That's right. She is.
Go with the flow.
Yeah. I have been, I'm going to say this also, I shouldn't, but I've been amazed at the job that you've done, you have done over the last year and a half. Many hats and keeping the place going forward.
For sure, right?
We
Not an easy task.
Well, thank you very much. And we have a great team. Our leadership team, our staff have done a great job, and everyone's just continue to focus on what's our purpose? Why are we here? It's for our patients. And we have to put a little plug in because we just had a wonderful federal site visit. A couple weeks before Bill started. Community health centers get reviewed every 3 years, and Bill was able, they allowed him to sit in on our final call, which was great. And basically what that means is that we're being good stewards of the federal monies that we receive to make sure that we're providing access to care for everyone and all those wonderful things that Bill's already talked about that we're doing. So we're really excited and proud of that fact. So,
summer is busy time at the center. We've got kids' physicals. The people want to get that taken care of during the summer.
Oh,
yes.
Yeah.
We're kicking off our what's an annual event now. Where we're trying to encourage kids to come in sooner. Don't wait till the last minute before school starts, and come on in and get your back to school or your sports physical ahead of time. And we have a raffle this year. We'll draw 5 names in June and 5 names in July. You can win a $100 gift card just by coming in and getting the care that you need, and making sure that you have all your immunizations up to date and all your preventive health screenings done. So,
Awesome.
yeah.
Well, thanks so much for being with us today,
Thank
Sarah.
you.
Yeah,
Pleasure to meet you, Bill.
Good meeting you,
Yeah,
fellas.
great
I
to be
mentioned
here.
earlier I'd already seen you
Yeah.
guys on JTV, and it's great to actually be here in the studio.
Yeah, looking forward to the next time for sure. Bill Wypyski, our new CEO at the Center for Family Health, with Sara Benedetto, COO. More of the morning show right after this.